My name is Dr. Angelo Del Re. I'm a pediatrician at Albemarle Pediatric Associates. Certainly you can get an upper respiratory tract infection or a common cold at any age. Children are somewhat more susceptible, and in particular more susceptible to secondary infections as a consequence of getting that cold. It's important to remember that upper respiratory tract infections are caused by viruses. There are several ways to prevent the transmission of a virus, and there are a lot of ways that we counsel mothers and fathers to prevent their children from either getting colds or spreading colds to other children, which is equally as important. The number one thing to remember always is to wash your hands and teach your children how to wash their hands. Of course that's age specific. Your infants can't wash your hands, so you have to do that for them and make sure that everybody's washing their hands before they handle your infant or play with them. Other ways to prevent the transmission of cold illnesses would be to keep the tabletops clean, counter surfaces clean, wipe them down with an approved cleanser. If your child is in a daycare center or a pre-K, they are exposed to more viruses and more colds during the winter months than the average person may be. So to try to keep them away from other children that are sick would also be something important you could try. We're often asked if cold medicines are okay to give your children, and the short answer is no. Children under 5 really shouldn't be taking any cough or cold medicines over the counter or prescription for that matter, due to the potential risk of having an adverse side effect or potential for misdosing. Children over the age of 1 can certainly have a teaspoon or a tablespoon of honey before bedtime. That's been shown to actually decrease nighttime cough and can be quite beneficial. Otherwise, for your infants who are suffering from a cold or a viral infection, one of the best things that you can do for them is to keep their airway clean. And what that means is to use a bulb syringe and to suction the mucus out of their nose. Sometimes even adding nasal saline drops, which you can buy over the counter, help loosen up the mucus and keep the airway clean. This allows them to breathe better and therefore allows them to feed better and prevents subsequent dehydration and other adverse events. A frequently asked question is when to bring your child to the doctor, when do they need to be seen by a physician? And there's a few key things that you want to keep an eye out for at home. So if your infant is having trouble breathing, retracting, sucking in under their ribs or nasal flaring, or having too hard of a time feeding because they can't breathe and feed at the same time because of so much congestion, then we would want to see them for that. It's always best to bring your child in if you're concerned for any reason to their pediatrician. They'll know your child the best, and they'll be keyed in specifically to certain pediatric problems and consequences that other physicians may not be as acute to. We have well-trained pediatricians at Albemarle, and we love caring for children.